that is actually the main problem. So what we have identified is that for the cells to undergo apoptosis, is that the patients who receive these cells must induce this apoptotic activity. To do this, the patient must harbor some levels of cytotoxic cells, either T or NK cells, capable of inducing MSC apoptosis. So we developed an assay by which we can quantitate the activity of these patients. And we have now identified a cutoff of killing by which we can separate and sensitively and specifically predict patients who respond or who do not respond to the cells. So this offers us the possibility to stratify and to select patients who are more likely to respond. So those who are, let's call it high killers, are the ones that respond in 90% of the cases. Those who do not kill in the opposite direction, only 10% of these will respond. So this gives us a very strong position to better exploit the treatment. There is another repercussion of this discovery, is the fact that we may still be able to act on patients who are low killers. And this is by inducing cell death in vitro in the mesenchymal stromal cells, so we can deliver something that otherwise would expect the patient to do. But if the patient cannot do it, we can deliver these cells which are already dying. And this will enable us to target more patients. Of course, this is to be verified in new clinical trials. Clearly, this is a new paradigm shift. We always want cells which, of course, are live. And in particular, regenerative medicine has always been based on the possibility of identifying progenitors or stem cells that are capable to replenish the tissue which has been injured. However, we also know that by controlling inflammation and stimulating the endogenous tissue repair, we can also achieve a similar aim. So we currently, I think there are other groups trying to identify which are the signals in the dying cell that can deliver this awakening signal to the tissue. And we expect that once identified, we will probably elaborate a molecular profile and therefore a signature that we can leverage to target a particular pathway in the parenchymal tissue that to stimulate their regenerative ability.